There are some people at the back here. Yes, we'll come back to you. You've already had a chance. We'll go to the very far back, and then we'll come to the lady over there. Bonnie McLafferty, yes.
Thanks. My name, I'm Asafa from World Vision. One question, that is optimizing access, export, and the safety of food.
Okay.
How that can be optimized? Because in the research, the disciplinary intervention, and at the end of the day, the research may end up with some blockage for some of the elements. So how that can be optimized, food access, safety, as well as export.
Great. Can we go to the lady over here with her hand up? Very good. And then the gentleman on your right. And then there's some over there too. Perfect.
Hi, I'm Bonnie McLafferty from GAIN. There's a research agenda around the process and acquisition of foods and whether, for example, outgrower schemes have a different level of infection than others.
Good. Okay. So we had, I think, we're moving to, okay, you already have the mic. Very good. Yes.
Okay, thank you. In our group, we come up with
Can we have your name again, please? Can you have your
I'm
name?
François Gasengaire.
Sorry,
in our group, we come up with 2 research questions. One has been addressed, but not fully. It's related to the risk factor and risk transmission pathways. For example, from the supermarket to the table, are we safe? Mm-hmm. The second question is related to the objectives. Rather than looking at it economic versus health, we can integrate both, asking the question, what are the opportunity costs of not addressing food safety?
Okay, good. So we got a couple more over here, I think. One, yes, perfect. Yes.
Mike Jones from IUCN's Resilience Task Force.
Resilience Task Force.
Resilience Task Force. Yeah, consistent with this idea that our group came up that we need to move to a risk-based approach. One suggestion is that the specialists on food quality and health concerns is they work much more closely with political and social scientists, do a rapid assessment using a very well-established resilience assessment framework, which gives you a holistic understanding of what a situation is and what the primary drivers are. Use that as a basis for thinking much more specifically about the kinds of integrated knowledge and research programs that need to be developed to address this in different regions across the world.
Thank you. We're happy to hear the word resilience for the first time this morning. Very good. And I think there's another gentleman here. Yes. And then we have space for one more after this. You have one there. Great.
I'm Kaba Joyner. Our little group felt that for food safety...
Can you put it a bit closer?
For food safety is from the farm to the mouth. You have to think about food safety that way. And when you think about it from the farm to the mouth, then you now start focusing on who should be responsible for food safety from the mouth, from the farm to the mouth. And therefore you would now you now see the appropriate sectors that would be involved or should be targeted. So we feel that the BCC is inadequate and this should be focused on.
Okay, thank you. We have a last one over here, please.
Hi, I'm Lynn Brown from Harvest Plus. This specifically focuses on aflatoxins and nutrition. So we know aflatoxin consumption by chickens means that they don't grow very well. We see almost a dose-response relationship between human nutrition in young children and aflatoxin levels. And yet we don't seem willing to move until we understand the biological pathway in humans from aflatoxin levels to stunting. So when are we going to do the research that actually enables us to prioritize this?
Okay, good. Then I think we've got a lot of feedback for you, John. We have about 5 more minutes for you to summarize everything and tell us what will happen next.
So first of all, if I won't. No, I think it's okay here. Yeah, this is a modest intervention. I won't be able to touch on every point you've made, but you made them and we've captured them. And obviously you probably haven't had enough time in your interventions to maybe tell us everything you'd like to. So when we can bring that back up and you can contact us. Just let me pull together some of the threads that I heard. So one was there was a widespread support that there's a growing concern. We heard a bit about, okay, what's the evidence? Are there trends? What's changing, et cetera? How do we capture that? And this concern spreads across different sectors. obviously decision makers and policy makers, public health, agriculture, food. It comes across another one. We heard about awareness of government, but not quite sure what they're going to do. We heard about the importance of this for different people in the value chains at different levels. What are they going to do? But basically we're talking about now there's a concern out there, but how do we shed light on a lot of these hidden concerns, and how do we actually get that out so that we can then move forward much better in terms of saying, okay, what's changing, what do we do about it, and how do we do it? Let me then focus on research, because I think there was a lot of good discussion about this and trying to put it together. There was obviously support for the idea that behind the scenes, the logic has to be related to risk mitigation, to looking at risks, to providing evidence, and that evidence had to be accessible to different sectors and different levels of people. Across this came the kind of feeling that we needed a systematic approach, and there was a lot of different interventions about how that could be done in terms of frameworks, who needed to be involved, that had to be along the value chain, it had to be at different levels of understanding. One of the things I liked, I think, was this systematic approach, but then differentiating different people within that approach, I think was a nice intervention. In terms of the kind of cross-sectoral research that needed to be done, I think we heard a number of things. We heard a strong plea on the evidence side for diagnostics, and I think this comes up a lot in terms of the quality of diagnostics, in terms of are they available in real time and in the real places we need them at a cost that's affordable. So this is obviously a priority, and it's something we see a lot in the public health side and in terms of a lot of the grand challenges programs and things too, which I think is great. And there may be some opportunities for linking up there. And that this diagnostic capacity had to be integrated into decision making, basically on the ground. In terms of mitigation, there was there wasn't so much discussion on technologies, a little bit, which I think is probably appropriate. We're talking about adapting technologies. We do have some technologies, they have to be relevant and applicable, but linking technologies to practice, that there was a lot of practice that was required, which then led to a kind of common theme around capacity, knowledge. You know, on the public health side, we think about knowledge, attitudes, and practice. And in our theories of change, we're often thinking about capacity, behavior change, performance as being quite critical. And that came up, I think, many times in terms of how we looked at that, in terms of providing information, in terms of the kind of research around that kind of knowledge and information and how it works. And there was also, I think, an interesting discussion about kind of common language and how we make this common language work so that everybody can communicate with each other, because we do need this systemic approach. There was some good discussion, I think, about economics and about health. There was pleas for cost effectiveness. There was a pleas for understanding kind of what motivates behavior. Is it knowledge? Is it capacity? Is it incentives? How do we look at that? So those were all useful. There was also a kind of thinking about what are the needs for kind of knowledge and information for different actors and how they would act, which brings me to the partnership sections. So we heard a lot about the partnerships between agriculture and health, but we got a lot of feedback that this needs to be broadened and that we need kind of partnerships that bring together both the kind of, let's call agriculture and health the biological dimension, but then to bring together the social dimensions and the economic dimensions, and that this was all going to be important because we're talking about behaviors and we're talking about real behaviors in real places, and this, I think, relates to the systemic approach but differentiated needs within a systemic approach. We heard, I think, some very sound things about embedding research within delivery, within capacity, within decision making. We heard some good points about the fact that people eat diets. They don't eat individual commodities, and we have to consider food safety from a whole holistic kind of diet perspective, vegetables, fruits, meat, milk, staples, how they come together. I think another critical point, and one that I think that Martha, you brought together well, is that in a sense of the public sector investments and how we work in this and how we add to research, we really need to understand how we're going to leverage the private sector and what they're doing and how we can build on that kind of market-oriented approach. I think, let me stop there. It was very rich, and Peter, I really appreciated the way you kind of managed this, because we've managed to harvest a lot for an hour and a half, and it's highly appreciated. Thank you.
Good. Thank you, everybody. Thank you very much. You've heard the bell. The bell means it's the end of the round, so to speak. Let's thank all of the speakers and the discussants. Thank you very much. Very thoughtful. And thank you all for your contributions. The word was, somebody did ask, who pays? There's a free coffee and tea outside here, and I think you have 15 minutes, and we think it's safe. Thank you.